Assalamualaikum. Today the topic is tracheal abnormalities. So the congenital abnormalities of trachea include tracheoesophagel fistula, tracheoesophageal fistula. It occurs in association with esophageal atresia. Here is a plain X-ray that's showing air in the esophagus. So the air is visualized in the esophagus. On X-ray, we can say that there is a fistula or there is atresia by seeing an air in the esophagus. So these are the types of the esophageal atresia and tracheoesophageal fistula. Normally, it contains the esophagus, trachea, lung, and the stomach. So trachea starts at the level of C6 and it divides till the level of T5. Carina. On inspiration, it's on T4 and expiration T6. Trachea's anatomy is it's 15 centimeter long, 2 centimeter in diameter, and there are 15 to 20 incomplete rings of trachea, cartilaginous ring, and there is posterior trachealis muscle. So the definite diagnosis of trachea is by barium swallow, and the tracheoesophageal fistula have 4 types. It form proximal communication with the esophagus. It form distal communication, complete communication, and double communication. So definite diagnosis by barium swallow and simple contrast angiotude. The anomalies that are associated, it include a term that is Vetter complex. And the Vetter complex, V stand for vertebral, A stand for anal, T stand for tracheoesophageal, and R stand for renal anomalies. Now there is tracheal narrowing. Tracheal narrowing is maybe due to extrinsic mass or intrinsic abnormality, mediastinal fibrosis, or intrinsic abnormality. There are some infected causes that involve acute or chronic tracheitis, laryngeotracheobronchitis, or CRU. It is the commonest cause of tracheal narrowing, and it's viral, and it affects the upper trachea and often occur in the young children. The other cause are the pyogenic bacteria, tuberculosis, tuberculosis cause the TB may cause a fibrosis, and it causes chronic tracheal stenosis or narrowing. Fibrosing mediastinitis, it is also due to tuberculosis and histoplasmosis. It can cause both tracheal and bronchial stenosis. The chronic infective etiologies involve, and they cause the rare in chronic inflammation of the trachea. This involves sarcoidosis, chronic relapsing polychondritis, Wegener's granulomatosis, rhinoscleroma, tracheopathia osteoplastica. There is one more disease that is saber sheath trachea. It is a condition that mainly occurs in older people, elderly man. Here there is a picture showing a stenosis of the trachea, and it is associated with COPD, chronic obstructive airway disease. It only affects the intrathoracic part of the trachea, which is narrowed from both sides, side to side, because there will be abnormal intrathoracic pressure. Primary tumor involve, and primary tumor are rare of trachea. So the benign tumors are usually small. They are well defined intraluminal nodules, and they are mostly papillomas, fibromas, chondromas, or hemangiomas. The malignant tumor involve they tend to occur closer to carina, and they involve squamous, adenoid cystic, or adenocarcinoma. They cause localized mass or long stricture, and the extra lumen outside of the lumen that is best assessed by CT scan. Tracheal stenosis results from previous injury or incomplete laceration of trachea, as well as iatrogenic causes such as previous tracheostomy or prolonged tracheal intubation. So prolonged tracheal intubation that cause the stenosis, that it is due to secondary to ischemia of the tracheal mucosa due to overinflation of the cuff of the endotracheal tube. Low pressure cuff have now been widespread to prevent this complication. So this complication can be prevented by using low pressure cuff endotracheal tubes. The rare causes of tracheal thickening or tracheal stenosis are amyloidosis, tracheopathia osteomalacia, and tracheopathia osteoplastica and tracheomalacia. So there are tumors of thyroid, esophagus, or lungs. They may also displace or compress the trachea. And if they are malignant, the tumors of thyroid, esophagus, or lung, they can invade the trachea. So the site of metastasis for distant primary tumor of trachea is melanoma. So whenever there will be a tumor, it will on barium swallow, it will cause filling defect within the tracheal air column. Next is the tracheal widening. This is the trachea showing lungs. So trachea is widened. Trachea normally widened or slightly become larger with increasing age. On CT scan, the maximum coronal diameter of the trachea is 23 mm, and in males, and 20 mm in female. And dilatation of the trachea is rare, and it can result from defect in the connective tissue diseases. Maurer-Kohn syndrome. It is a syndrome that is associated with Ehlers-Danlos syndrome. It is also known as tracheobronchomegaly. It is associated with Ehlers-Danlos syndrome or bronchiectasis. The trachea may be as wide as vertebral bodies. The contour will be uneven. There will be bulging of mucosa between the cartilage ring. The dilatation can proceed no further than main bronchi. So this was about tracheal abnormality. Next we will study the